Hi, my name is Dylan Cheney, and this is my presentation on nutritional deficiencies in children with autism spectrum disorder. So, what is autism spectrum disorder? Autism is a developmental disorder usually diagnosed at a very young age. Individuals with autism might struggle with social communication, repetitive behavior, or obsessive and restrictive interests. Every individual with autism could demonstrate a wide array of characteristics with varying levels of severity. The exact cause of autism has not been discovered yet. However, scientists believe genes and environmental influences could be a factor. Lorna Wing, a writer, psychiatrist, researcher, and activist for individuals with autism and their families, was the first to use the word spectrum in regards to autism. Originally, she came up with the word continuum. Quote, she felt it expressed the way that autistic traits appeared in such a wide variety of intensities and combinations among people of such divergent intellectual and social capacities. The word continuum, she said, described a concept of considerable complexity rather than a simple straight line from severe to mild, end quote. This is my amazing son, Tristan. Tristan was diagnosed with autism at the age of 2. Tristan has high-functioning autism, however he still struggles with sensory sensitivities, behavior, and some educational skills. Tristan is an extremely picky eater, and while he doesn't have a horrible diet, I sometimes wonder if nutritional deficiencies could be a factor in some of his autistic characteristics. This is Tristan at 3 years old eating his staple corn with corn dog. I think he ate this meal for dinner for a year straight. Currently, his staple meal is a quesadilla with peas. Now, you might be thinking, at least he is getting some vegetables in his diet. However, Tristan will refuse to try any new foods and is missing a lot of key macro and micronutrients in his diet.
I go to.
One thing that is common among children with autism are feeding disorders. A child will be diagnosed with a feeding disorder if they do not consume enough solids and liquids to sustain growth and healthy development. The Applied Behavior Analysis Education Group estimates that up to 90% of children with autism suffer from a feeding disorder. The link between autism and feeding disorders starts with the child's refusal to accept a variety of different foods. For example, the child might only eat foods that meet particular standards, like color or texture, or an absolute refusal of an entire food group like fruits and vegetables. A research study done in the United Kingdom examining the diets of 17 children with autism found that nearly 60% of the children ate fewer than 20 different foods, and over half refused to try new foods. In one survey, 100 parents of children with autism were interviewed, and close to 70% reported their child was a picky eater and that smell, texture, taste, appearance, and temperature all played a major role in their child's food selectivity. Is it possible that feeding disorders among children with autism not only deters their physical and mental development to adulthood, but also increases negative autistic behaviors? It is clear that the child's food selectivity is a result of the autism diagnosis. However, with therapeutic feeding intervention and a revised nutrition plan, could some of the child's autism symptoms lessen? Research on diet and nutrition in relation to autism is still developing. However, most recently, the role of the gut microbiome in children with autism has proven that the two are related and need to be looked at closer. The gastrointestinal microbiota is an assortment of microbes, bacteria, viruses, fungi, originating in the GI tract, which is sometimes called the microflora or gut flora. The assortment of these genes and genomes of the microbiota is called the microbiome. The microbiota and its relationship to brain function is an extremely important connection that has started to gain scientific popularity in recent years. The gut-brain axis is considered a communication route between the brain and the gut and is observed as a bidirectional communication system. GI tract complications and disease can differ between normal function children in children on the spectrum. In one study, it was observed that there was a GI tract complications in 84.1% of children with autism, while there was only a 31.2% prevalence in normal functioning children. If the gut microbiome has such an impact on our brain function, what can be done dietarily to restore the microbiome in autistic children that suffer with GI tract complications? In recent years, there have been two approaches that have been most common in the restoration of the GI tract. These two approaches include first, the additive approach, which encompasses adding vitamins, probiotics, and fatty acid supplements to the diet, with the second being the subtractive approach, which encompasses reducing/limiting gluten, carbohydrates, and dairy in the diet. The ketogenic diet is a low-carbohydrate, high-fat diet that has been shown to help individuals who suffer from seizures due to epilepsy. In recent years, there has been studies on whether the ketogenic diet could be beneficial to other neurodevelopmental disorders like autism. The ketogenic diet alters neurocellular metabolism through utilization of ketone bodies as an alternative fuel for the brain. In one study with 30 autistic children, 60% showed improvements in hyperactivity, social interaction, and learning after a 6-month study. There has also been more scientific research that has shown a link to children with autism and gluten or dairy sensitivities. It is believed that a majority of children with autism have leaky gut syndrome, which is abnormalities in intestinal permeability that allows large peptides to be absorbed directly into the bloodstream and reach the brain. The elimination of said gluten and dairy in one study over an 8-year span found 81% improved in eye contact, social interaction, and hyperactivity. Research is fairly new when it comes to the effects of substituting, adding, or subtracting from a child's diet who is on the autism spectrum. The fact that there is a spectrum and level of severity among children with autism makes research that much more complicated. The effectiveness of nutritional-based therapy in regard to diet changes and feeding interventions are still being researched. The gut microbiome clearly is having an effect on mental function, but how much seems to be dependent upon each individual. In regard to autism, the spectrum of severity between each patient makes it difficult to clearly identify one specific diet change, if any at all. As it is with normal functioning individuals, diet and nutrition is not a one-size-fits-all. The effect carbohydrates, protein, and fat have on an individual can be based on a number of different qualities, such as age, sex, genetics, physical activity level, along with many other factors. It is best, as is with normal functioning individuals, to get tested to see where the nutritional deficiencies lie and make the necessary adjustments. Does the child have a gluten sensitivity? How does the child react to dairy? Are there issues appearing in the GI tract? How complex and diverse is the child's diet? Is the child consuming enough fruits, vegetables, and essential micronutrients? These are all questions that must be answered before going forward with any drastic dietary changes. Occupational, behavioral, speech, and feeding therapies are all extremely important in assisting in an autistic child's development. In 5, 10, maybe 15 years, it might be discovered that nutrition and diet should be added to that list.